Hello, it's Dr. Barr, and today I want to talk about one pill, a single pill that can help you regrow your hair or treat an enlarged prostate. But it comes with risks you need to understand. So today we're going to talk about this one pill called finastride, and it's sold online. So you guys got to be careful. It's sold for hair recovery and stops hair loss. So let's talk about it. So this video is for curious people who want to know about finastride. I'm a doctor, however, this is an informational video for educational purposes only, okay? So let's dive into this, and I think you should talk to your doctor before we um, get you any of these things, right? So before you get any finastride or any other of these products, please talk to your doctor first because these are the things that I worry about. So finastride is a prescription medication, and it has primarily been used for hair loss. Okay, so androgenic alopecia, that's a big word, but it's because androgens, which is like testosterone derivatives, are the reason why male baldness happens here first. This receding happens because of dihydrotestosterone and also followed by the crown being lost. So dihydrotestosterone is a very strong male hormone, and it's so awesome because we have it in our body and it acts like a backup for testosterone. However, when it goes out in the scalp, it creates so manly guys have too much testosterone, they start losing hair and they have the male pattern of baldness. The females have the baldness here, males start on the side. So, what can we do about this is coming next. The other reason we use finastride for in medicine as a prescription is BPH, which is benign prostate hyperplasia. So it's enlargement of the prostate, which is meaning that you are as symptoms going at night to the bathroom more than you need to, like 2, 3 times now you wake up and have to go to the bathroom. You don't have a good steady flow of your pee, dribbles, all that kind of stuff. It's difficult to get it out. So the FDA approved in 1992 the Proscar for the prostate enlargement. That is the Proscar is the name for finastride for prostate treatment. And in 1997, it approved Propecia for hair loss. And they come in a pill form, oral tablets, or in some cases, they are topical solutions. So some of you have used it as a topical solution, and some people combine it with minoxidil. So primarily, men use it, not women, because we know that it can cause major problems during pregnancy for the fetus. So it's never prescribed for females. How does finastride work? This is where we're going to talk about how it really can stop the hair follicle from dying off. So finastride is a 5 alpha reductase inhibitor, which blocks the conversion of testosterone to dihydrotestosterone. So I can have a little chart for you there. 5 alpha reductase is a hormone that is produced in our body, and an enzyme, 5 alpha reductase, and the finastride is an inhibitor for 5 alpha reductase, and that is why it reduces the hair loss and reduces the weakening of the hair follicle, and then it will stimulate the hair growth again. So for BPH, which is the prostate hyperplasia, DHT, dihydrotestosterone, also shrinks the prostate, relieving urinary symptoms. Okay, so DHT inhibitors shrink the prostate and urinary symptoms get better. How is it effective? Yes, it is effective. So 80 to 90% of the men experience slowing of the hair loss. 80 to 90%, that's a good number. And about 50 to 60% see regrowth, maybe after a year. Okay, so it takes quite a bit of time. Results vary, and it works best in the early stage of hair loss. So if we're like shiny up here, that's what I tell my guys. If it's shiny, nothing's going to regrow. All right, BPH, improving the urinary flow and reducing the prostate size in many men, and that takes about 3 to 6 months. So nothing happens overnight. So you need to take these medications for quite a bit of time. So emphasis 3 to 6 months for hair loss, at least as minimum. 6 to 12 months sometimes to see the hair regrowing, and prostate again 3 to 6 months before you see the results. What is the benefits? Like, okay, hair loss slowing, promotes regrowth of the hair, and prostate, maybe we will avoid the prostate surgery and reduce urinary symptoms. But this comes with huge side effects and risks. What is the risk that I'm talking about? Is that unfortunately men take it and they start having issues in the bedroom. So 1 to 10% of users, that's a big number. 10 out of 100, that's quite a bit of people, have sexual problems, decreased libido, erectile dysfunction, problems with ejaculation, and reduced semen volume, meaning like fertility, right? So that is a scary thing. Breast changes also, they start having increased breast size and breast tenderness. So rash, dizziness, fatigue can be another symptom. However, the serious side effect that I want to talk about today, and there's support groups out there, if you guys look at PFS, Post-Finastride Syndrome, these are conditions that are reported in men involving persistent sexual dysfunction, ED, that is persistent, cognitive problems, emotional symptoms, brain fog, depression, anxiety, that is bad, even if those guys stop the medicine. So studies suggest about 89 to 90% with will have persistent sexual side effects. They meet this sexual dysfunction criteria, and really it's not a good thing, right? Because PFS is a concern. Depression, anxiety in other users, and hormonal changes is another problem. Fertility, that is another problem. So these are long-term problems that can happen with finastride. Is that worth it? No, right? Allergic reaction is another problem, but I mean, I'm worried about the sexual dysfunction, right? And ED and infertility. That is a concern. So, what are the alternatives? What are the alternatives that can do that? Oh, by the way, if somebody is smoking or obese and takes these medications, increases their risk for the side effects. So, that's another thing. So, what I would like to do is like maybe offer some other alternative for that. There are natural alternatives like saw palmetto is another good one that you can use. It's a natural plant based, and you can take that. I have it in my TRX supplement. Also, you can do things like natural oils, like rosemary oil is another good one that you can use. And some people say, like with the rosemary oil, the gray improves and it's great for your hair. It's shiny and nice. So if you can promote the hair growth. Minoxidil is another one. Minoxidil is a prescription though. Another time, sometimes we mix it with finastride, but also you can compound it in a topical. Some people said finastride topically is okay. However, I have a problem with it because it will still be absorbed. So less risk, but it will be absorbed. Honestly, if you put anything on your skin, you take a shower, you're eating it. And it can be transferred to other people. So if you have kids at home or a wife, that's not good either, right? So I would say be careful with finastride. And guess what? It's all online. Hims, you guys, Hims, like they're selling you that all the time. And then, hey, oh, no problem. Now you need ED pills. Let's sell you some Cialis and Viagra. Good sales tactic there. Let's fix your hair. But guess what? You're going to be our customer next time. Before you leave, you're paying us $500. So I think it's very important to know what you're putting in your body. Finastride is a medication that has been used for a long time. There are other alternatives. I like my alternatives that I very natural peptides, which is the GHK, TB4, and BPC. Topically, we do microneedling to this hair area and we get hair back. The other thing is exosomes. A lot of people have done exosomes. You don't have to go to transplant plans right away, but exosomes and stem cells is another alternative. I like to use that with red light therapy. Red light therapy, a cap, red laser cap, or low energy laser cap, have been used. And if you take the right supplements and nutrients and block the DHT in the topical area, which means you kind of do minoxidil, even though it irritates the scalp a little bit, but it's better than nothing. Mix it with other essential oils that can help you, right? Or natural ingredients that you can use it in topical, then you don't have that issue of losing the hair, or recovery actually is good with some of these products as well as using them with peptides. So anyway, this is Dr. Barr. I want you to leave me a comment if you have any. If you have tried some finastride, please let me know about it. If you have anything to share about the PFS, it's very important for people to learn about this. There's PFS groups out there. You can find them and for support. And unfortunately, it is an irreversible situation. We want to try to avoid it. Please join my channel. Please subscribe and send me comments. And if you have interest in other topics, let me know. Thank you so much. And I hope this was useful. Finastride and the PFS syndrome, finastride, post-finastride syndrome, which is real, guys. Just make sure that talk to your doctor before using finastride and ask them why and can they replace it with something else, right? Thank you so much for listening.